Welcome back. It's Dr. Denton with Salisbury Eye Care and Eyewear, and I'm here today to answer a couple more FAQs about dilation. One question that we get every single day is it really necessary to get dilated every single year? Many of our patients will come in for their return exams and say, gosh, I feel like I just did this last year. Is it really necessary to get dilated again? I do err on the side of dilating every patient every year. Dilation is so important because it opens up your pupil. I kind of liken it to opening the window so I can see more of the back of the eye. Each and every time you're dilated, I am looking for all kinds of irregularities in the back of your eye. Sometimes these are as a result of a disease process. I can see things like diabetes changes, high blood pressure changes in the back of the eye, tumors, freckles in the back of the eye, vasculitis, glaucoma, infectious diseases, macular degeneration. All of these sorts of things can be seen in the back of your eye with dilation. Perhaps one of the scariest things that can happen without any symptoms and without any health problems is the incidence of a retinal hole or tear. So the retina is that structure at the back of the eye that I'm examining when you're dilated. And it is entirely possible to be a young, healthy patient with no medical issues and have a tear or a hole just develop in your retina. The problem with something like that happening is it can be completely asymptomatic. You would never even know that it had occurred. And the presence of a hole or a tear, if fluid then gets behind it, can cause what's called a retinal detachment. Retinal detachments can be devastating to your vision. You can lose all of your vision in an eye in very short order from having a retinal detachment. So again, I know it's not the most fun thing in the world to be dilated every year, but it is for your best eye health. I'm looking at all those structures, and we are just making sure that they're healthy every single year. And if there is a problem, we catch it sooner rather than later so that treatment can be initiated. I just want to encourage you to always opt into dilation at your eye doctor. There is currently no picture, no test, nothing in my personal opinion that can replace being dilated. There are really good tests. There's tests that show 80% of the back of the eye or 90% of the back of the eye. But as your eye doctor, I feel it's my responsibility to have looked at all of the back of your eye every single year. And so I may be a little bit old-fashioned. You're gonna hear from others that there are replacements from dilation. And we can agree to disagree, but I really believe in dilating every patient every year. If you have questions about that, feel free to leave them below, and I'd love to chat with you about reasons why I dilate. If you've had an eye exam where you were completely healthy and you got dilated and your doctor found something wrong that potentially saved your vision or your life, I'd love to hear those stories down below as well. Thanks again for tuning in. I'll see you next time here on the channel every Wednesday, 4 o'clock.